Healthcare is a critical part of the equation. Yet for too many families, the cost of care continues to rise while transparency remains out of reach.
It's your impeachment articles, sir. You have abused your office, you have gutted America's public health, and you have sacrificed our leadership in medical research and innovation. Americans today are less safe under your watch. Children are dying of diseases that we thought we had eradicated. You can smirk, sir, but I answer to the people of Michigan, and they have told me you should be ashamed, you should resign, and if you refuse, Congress should remove you from office.
What was supposed to be another bruising congressional hearing became something much bigger when Michigan Democrat Haley Stevens looked directly at Health and Human Services Secretary Robert F. Kennedy Jr., cited the surge in measles cases, and then told him she was holding his impeachment article. In a matter of seconds, a policy hearing became a political spectacle, and a brutal referendum on Kennedy's handling of vaccines, public health messaging, and trust in science.
Well, thank you very much. Congresswoman, I can't comment on mifepristone because it's under litigation now. We've been advised by the Office of General Counsel that they don't want me talking about it at all. But thank you for your concerns. I share President Trump's concern that we can't be a moral nation with 2.1 million abortions every year, and that the government has an obligation to protect women and babies.
Yes, and when the government promotes it and pays for it and lies to women, we know for a fact that at least 80% of women, when they have an ultrasound, when they are given the information on the development of the child, when they are given the support and information on how to access help, that they will choose life and not abortion. And I don't know why this is the only medical procedure that I know of that we withhold information from the patient so that we can tip the scales to a certain choice. The left is not pro-choice, they are pro-abortion. Thank you. And
the gentlelady's time has expired. I now recognize the gentlelady from Michigan, Ms. Stevens.
Well, thank you, Mr. Chair, for holding this hearing, and Mr. Secretary. It is, in fact, true. I come from the great state of Michigan, and as you enter your second year as our nation's Health and Human Services Secretary, I just had a few things I wanted to tick through with you here today. So in early 2025, after your confirmation, measles cases spiked in the United States to the highest level since 1991. Last year, we had over 2,200 cases in America. 3 people died, 2 were children. Do I have that correct? Because according to the CDC and the American Academy of Pediatrics, I do. During this same time,
that epidemic started before I came
during
into
this
office.
same time, you questioned the effectiveness of the measles vaccine. And then in September, your hand-picked vaccine panel voted against recommending the combined measles vaccine for children under 4. This is true?
It was dangerous.
We know now that over 90% of measles cases in 2025 were among people who were unvaccinated or whose vaccination status was unknown. That's correct? According to the CDC,
I think we should have given a dangerous vaccine that all the science
in just the first 3.5 months of 2026, the year we're in right now, we've already seen an additional 1,700 measles cases. I assume you're aware of this, according to the CDC.
There's a global epidemic.
You have also pushed vitamin A as a treatment for measles. That is correct?
Yeah, every
According
major
to
health
the America's
organization in the world
Poison
recommends
Centers,
it.
vitamin A overexposure among children increased by nearly 40%. And in this time frame, children in the hospitals with both measles and unsafe levels of vitamin A has occurred, correct?
I'm not recommending unsafe levels.
Stevens didn't open with rhetoric. She opened with numbers. She tied Kennedy's tenure to a measles resurgence that she said had already taken America back to levels not seen in decades. Then she connected that outbreak to what critics say has been one of the defining features of Kennedy's time in office: public skepticism around vaccines, confusion in federal messaging, and a steady collision between political ideology and medical consensus. Kennedy pushed back, arguing the outbreak began before he took office and insisting the problem was global. But by then, the damage in that hearing room was already done.
RFK Jr. has got to go. Today I introduced articles of impeachment to remove him from office. RFK Jr. has turned his back on science, on public health, and on the American people. Under his watch, families are less safe, healthcare costs are skyrocketing, and life-saving research, including right here in Michigan, is being gutted. RFK Jr. is the biggest self-created threat to our health and safety. I cannot and I will not stand by while one man dismantles decades of medical progress. Enough is enough, and that is why I'm pushing to impeach RFK Jr., to hold him accountable, and to protect the health, safety, and future of every Michigander. Because our health, our science, and our future are worth fighting for. But I answer to the people of Michigan, and they have told me, you should be ashamed, you should resign, and if you refuse, Congress should remove you from office.
The real force of Stevens' argument was not the impeachment line itself. It was the chain she tried to build before it. First, measles cases surged. Then, vaccine confidence eroded. Then, according to critics, the federal government stopped speaking with the urgency the crisis demanded. Her accusation was simple. This was not just bad judgment. It was a public health failure with visible consequences.
Under my leadership than any country in the world in limiting it. Last year, we had approximately 2,200 cases. Mexico had more than 3 times that number, and they have 1/3 of our population. Canada had double that number, and they have 1/8 of our population. Europe had almost 10 times that number, and they only have double of our population. Many other countries have lost their elimination status. Canada lost it. Britain lost it. These are countries I haven't visited in years. Many European countries have lost it, Austria and others. I want to say something because 2 little girls died tragically in the Mennonite community in Texas. The Mennonites have not vaccinated since 1796. Oh, this has nothing to do with me. I went to the funeral of one of those little girls, and I spent a day with the family of the other. And both of them told me that when they took their children to the hospital, they were treated as pariahs. They were shamed. They were not given proper treatments. Both families believe their daughters, and their own doctors believe their daughters could have been saved if the hospital gave them proper treatment. The fact that they did not have a proper treatment to give them is regulatory practice by this agency.
And this is where the hearing stopped being just a partisan clash and became a battle over competing realities. Kennedy's defenders say he is challenging broken systems, asking overdue questions, and refusing to rubber stamp public health orthodoxy. His critics say that in the middle of a measles resurgence, doubt itself becomes dangerous, especially when it comes from the country's top health official. That is the fault line underneath this entire exchange.
Hospitals. Look, to top it off, Mr. Secretary, I got a copy of H.R. 944. Do you know what it is? It's your impeachment articles, sir. You have abused your office, you have gutted America's public health, and you have sacrificed our leadership in medical research and innovation. Americans today are less safe under your watch. Children are dying of diseases that we thought we had eradicated. You can smirk, sir, but I answer to the people of Michigan, and they have told me, you should be ashamed, you should resign, and if you refuse, Congress should remove you from office.
Then came the line that changed the tone of the room again, not from Stevens, but from the Republican who followed her. Missouri Congressman Bob Onder dismissed the confrontation as a made-for-social media stunt, saying he was glad his colleague got her little X clip. In that moment, the hearing exposed something else about modern politics. Even the accusation of political theater has become part of the theater itself.
As we mentioned here, we are awaiting this news conference with RFK Jr. and Dr. Oz. Now, they are expected to speak about a variety of health-related topics. Now, we do know here that as we bring you those comments, we do have some articles of impeachment that we are hearing have been filed against RFK, coming in from Congresswoman Haley Stevens. She is a Democrat from Michigan. She did post a very brief statement on her social media, and I do want to pop this up on your screen here. Again, this coming in a short time ago. as she said, "Today, I formally introduced articles of impeachment against Robert F. Kennedy Jr. RFK Jr. has turned his back on science and the safety of the American people. Michiganders cannot take another day of his chaos." RFK serving as the secretary there of Health and Human Services. The Congresswoman did post this very short statement as well, and I do want to play it in case you missed it earlier.
RFK Jr. has got to go. Today, I introduced articles of impeachment to remove him from office. RFK Jr. has turned his back on science, on public health, and on the American people. Under his watch, families are less safe, healthcare costs are skyrocketing, and life-saving research, including right here in Michigan, is being gutted. RFK Jr. is the biggest self-created threat to our health and safety. I cannot and I will not stand by while one man dismantles decades of medical progress. Enough is enough, and that is why I'm pushing to impeach RFK Jr., to hold him accountable, and to protect the health, safety, and future of every Michigander. Because our health, our science, and our future are worth fighting for.
What happened in this hearing matters for a reason bigger than one viral exchange. The Secretary of Health and Human Services is not just another political appointee. That office shapes vaccine guidance, outbreak communication, research priorities, and the credibility of the nation's health institutions. So when a lawmaker stands in Congress and says children are less safe under that secretary's watch, that is not ordinary partisan language. It is a direct challenge to the legitimacy of the country's public health leadership. In Washington, moments like this are often dismissed as theater. But theater does not happen in a vacuum. It happens because something real underneath it has broken open. Haley Stevens turned a hearing into an indictment, not just of Robert F. Kennedy Jr., but of a public health era defined by distrust, political branding, and collapsing consensus. Kennedy's allies see a reformer under attack. His critics see a health secretary whose instincts have made a dangerous moment worse. And as measles cases climb and confidence in institutions keeps falling, the question left hanging in that hearing room is not whether the clip will go viral. It is whether the country can afford for this fight to keep escalating while preventable diseases come roaring back.